Yes.
Okay, perfect. So again, welcome to our presentation, Medicare and your UC sponsored medical plan. I just want to let you know that this is not an open enrollment presentation, so there will be a little bit of open enrollment information, but if you want the full extent of open enrollment, I will give you that information on when those presentations will be held towards the end of these slides. Hopefully everybody can hear me all well. But again, my name is Ronisha Roberson. I am one of the healthcare facilitators for UC San Diego. Myself, along with my colleague Lilia Huato, we service UC San Diego campus and health, faculty, staff, retirees, survivors, and their dependents with healthcare related issues. Now, what we do is we can assist you with understanding your UC health plan coverage and patient rights. We will define your healthcare issues and help you navigate which plan is right for you. Also assist you in navigating the healthcare system, resolve issues with your doctor, medical group, or medical plan carriers. And we assist with understanding how Medicare benefits coordinate with UC sponsor plans. What I'm hearing some background noise. Is anybody asking a question? No? Okay. What the HCF is not here to assist you with is providing medical, tax, or legal advice. We do act as a liaison, but we would not advocate for services or benefits that are not covered under any UC plans, and we cannot suggest any treatment plans. This is a confidential service, and we do follow HIPAA laws. Now we're going to dive into the Medicare content. If you have questions, you can put them in the chat. However, we do have a time at the end of the presentation for live Q&A, and we know that Medicare brings up a plethora of questions. So hopefully I've done a good enough job where your questions will be answered, but again, there will be time for Q&A at the end. So we are going to discuss Medicare basics. We'll go into the UC's Medicare requirements, UC's plan options, the plan premiums, have a couple of questions for test your knowledge, and then we'll give you some tools and resources at the end. So let's begin with the Medicare basics. Medicare is a federal program, and it provides healthcare coverage for individuals who meet the following criteria. You're 65 or older with over 10 years of work experience, or what they call 40 employment credits. This is the most common time that people enroll for members of UC. If you're under the age of 65, you may qualify if you are disabled as determined by Social Security, or if you have been receiving Social Security income for a minimum of 24 months. You may also qualify if you have end-stage renal disease or ALS, also known as Lou Gehrig's disease. Medicare plays an important role in coordinating with your UC retiree health benefits and covering your health care costs as you age. If you're like most people, when you turn 65, you will become eligible to enroll in Medicare. UC offers two types of Medicare plans, Medicare Supplement and Medicare Advantage plans. We will discuss these plans more in detail during the presentation. To make sure you have the right coverage and to avoid any Medicare premium penalties, it's important to understand the rules and enroll properly and on time. All the information that you need is located in the UC Medicare fact sheet located on UCNet, and the link is posted here. Now let's talk about the parts of Medicare. Medicare is made up of 4 parts. You have Medicare Part A, which covers your hospital inpatient care, skilled nursing and hospice care, and home health services. It's usually premium free if you, your spouse, or your ex-spouse have worked full-time for 10 years and paid Social Security taxes. If you qualify through your spouse or your ex-spouse, you would need to have been married a minimum of 10 years. Part B is your medical insurance. Part B covers your doctor's visits, ambulance services, labs, x-rays, physical therapy, durable medical equipment, and preventative care. You will pay a monthly Part B premium to CMS, the Centers for Medicare and Medicaid Services, or it can be automatically deducted from your Social Security check if you're receiving Social Security. Part C is not necessarily a component of Medicare, rather it's a type of Medicare health plan. It's also known as Medicare Advantage plans. They're health plans offered by Medicare-approved private companies that contract with Medicare to provide you with all your parts, A, B, and D benefits. The UC does offer Part C plan designs, which we will cover more details later in the presentation. And then you have Part D. The Part D is your outpatient prescription drug benefit. Most UC retirees do not pay an extra premium for Part D unless they're in a higher income bracket. And the UC coordinates Medicare with Part D with your UC Medicare plan. Now, UC plans do include the drug benefit Part D coverage, and the prescription drug coverage of UC medical plans is equivalent to or better than the original Medicare Part D plans and is considered creditable coverage. The formulary for prescription drugs may differ, may differ from your non-Medicare plan, so remember to review your evidence of coverage booklet for more detailed information. Enrollment in another Part D plan may result in loss of coverage. Retirees with Medicare must complete a form, we call them the UBIN forms, to assign your prescription drug coverage to your plan, and we'll discuss those forms later on. Most plans with Medicare prescription drug coverage have a coverage gap that you may have heard of called a donut hole. This means that after you and your drug plan have spent a certain amount of money for covered drugs, you may pay all costs out of pocket for your prescriptions up to a yearly limit. UC does not have this clause. As we stated in the previous slide, all of your Medicare plans with UC have Part D coverage included. So you don't need to go out and purchase a separate Part D plan. And if you do, you may be subject to losing your UC coverage. Do not enroll in a separate plan, and if you do, as we said, there's no duplicate coverage allowed. The only exception is if you enroll in the UC Medicare PPO plan that does not have prescription drugs, or if you have triple coverage through UC with Medicare and CalPERS or TRICARE for Life. Now, if you are 65, chances are, as we stated, you would qualify for Medicare. If you're retired, UC offers several plans that coordinate with Medicare. And if you're still working, UC's employee medical plan generally remains your primary coverage, even if you enroll in Medicare. If you're under 65, if you have some special qualifications, you may also have this Medicare plans available to you. When you enroll in Medicare, you need to ensure that all of your Medicare premiums are paid for you to keep your Medicare coverage and therefore keep your UC coverage. If you fail to pay and maintain your Medicare, you will lose your UC coverage. So this slide shows the premiums that may be assessed by Social Security and CMS for those that are enrolled in Medicare. Now, everyone will pay the standard premium for Part B, and A and D, as in dog, are usually premium free. But the standard premium for Medicare are generally either taken out of your Social Security check or billed to you quarterly. The standard Part B premium for 2024 is $174.70, but the new rates for 2025 have not been released yet. There also may be a late enrollment penalty assessed. So if you enroll in Part A and don't enroll in Part B when you're eligible, you will receive a late enrollment penalty, which is 10% of your premium added to your monthly premium rate for 12 months that you did not enroll. The same late enrollment penalty for Part D will be assessed at 1% if you did not have credible coverage for 63 or more days. So you have 12 months not being enrolled, 10% for each month, and then 63 days at 1% for Part D. And then there's the IRMA, and I'll explain this in a little bit more detail in the next slide. But IRMA is the income-related Medicare adjustment amount. So less than 5% of individuals that enroll in Medicare are required to pay a higher premium because their income is higher. So they'll be paying the higher premium for Part B and D, and the coverage is based on the previous year's tax return. And then failure to pay the adjusted higher amount will result in loss of your Medicare coverage, and then that'll trickle down to losing your UC coverage. If you're still working but did not apply after you turn 65, this late enrollment penalty does not apply to you, but the IRMA may. You will enroll during a special enrollment period if you're still working after 65, and we'll explain those enrollment periods later. So this is the IRMA, or the income-related monthly adjustment amount. So the thresholds are based on individual and joint tax returns for the 2024 premium rates are listed to the right. So income-related adjustments begin at $103,000 for individual and $206,000 for joint filers. But you do have a right to contact Social Security and CMS and request a lower IRMA amount. And again, this is up to Social Security and Medicare and CMS, not UC. These are assessed by them, not UC. As we stated in the previous slide, these are the monthly Medicare premiums for 2024. We have not received 2025 income rates yet. From 2023 to 2024, there was a $9.80 increase. They're estimating that the base premium or the standard premium for Part B for 2025 will be around $180. So that's a $6 or $5.30 increase. Medicare premiums are based on your income from 2 years prior. So your 2024 rates will be based on 2022 income, and 2025 rates will be based on 2023 income. Most people who qualify for Medicare receive Part A premium free if they've paid into those Social Security FICA taxes for 10 years and have the 40 employment credits. If you have less than 40 employment credits, you will have a premium. As you see here, for 30 to 39 credits, the premium would be $278 per month. And from 0 to 29 credits, it's $505 per month. Medicare Part B will always have a premium, and the more income you make, the higher your premium will be. The standard rate for Medicare Part B for someone making $103,000 or less as an individual, or $206,000 or less for a joint filing, the premium is $174.70, and $0 for Part D. And as you see from the chart, the premiums increase as the income increases. Also, as with Part A, most have a premium-free Part D unless you are in a higher income bracket. We want to make sure you note, can you make sure you're on mute? I can hear someone speaking in the background. We want to make sure that you note that your Medicare premium is paid in addition to your UC medical plan premium. They're separate. So your plan premium is coming out of your pension check while you pay that Medicare premium directly to Social Security and Medicare. If you're not eligible for Medicare under your own work record, you will need to show proof to the UC, and that will allow you to remain covered under a non-Medicare plan, but keep in mind you may qualify another way. If you do not have the required 40 credits, you may still be able to qualify for premium-free Medicare Part A based on your spouse's work history if they have the 40 work credits. This is known as a spousal benefit or spousal coverage. You will qualify for premium-free Part A under your spouse's work history when they are 62 and have the 40 work credits. And either of the following: you are currently married and your spouse is eligible for Social Security benefits either through retirement or disability, and you must have been married for a minimum of 1 year before applying. You can be divorced and your former spouse is eligible for Social Security benefits, either retirement or disability. You must have been married for at least 10 years and currently single. You may also qualify under a deceased spouse if you're a widow or widower and married for a minimum of 9 months before your spouse passed away. You must currently be single. Again, to know everything you need to know, that Medicare fact sheet, you can scan the QR code on your screen to go straight to the web page for the Medicare fact sheet. If you're currently collecting Social Security income, they will automatically enroll you in Medicare Part A and B 90 days before your 65th birthday, and they'll send you your Medicare card reflecting this. And those Medicare premiums we just discussed will be deducted from your Social Security income. If you're not collecting Social Security, you should begin applying 90 days or 3 months before your 65th birthday, and you may apply in person, online, or via telephone. You will be billed by Social Security and pay them directly. If you have been denied Medicare, request a denial letter, notify UC, and you will end up staying on the non-Medicare plans. Coverage in Medicare will begin on the first day of your birth month, unless your birthday falls on the first of the month. And then in that case, your coverage will begin the first day of the previous month. So enrollment periods, when do you enroll in Medicare? Outside of being automatically enrolled through Social Security and collecting Social Security income, there are 3 additional enrollment periods. The first is the initial enrollment period, and this is when you first become eligible at the age of 65. That's a 7-month period, 3 months before 65, your birthday month, and then 3 months after. The second is the special enrollment period. This is usually the period those who are still working will enroll during. You will qualify for enrollment during the special enrollment period when ending your employer group health plan coverage and you are over the age of 65. This is an 8-month period, and it will begin on the first day of the month your employee coverage ends. Your third enrollment period is the general enrollment period. This is when anyone who missed the other 2 enrollment periods will enroll in. If you are enrolled in Medicare Part A and B and you were terminated due to non-payment, the general enrollment period is when a member should enroll in Part B. If you enroll during the general enrollment period, it is only during January 1st through March 31st of each year, and your coverage will begin on July 1st. If you choose to enroll using the online option, this is the landing page for the Social Security website, www.ssa.gov. This is the page that you will go to when you sign up for Medicare. You can also check your accounts to see how many work credits you have. You can check your application status, and you can obtain replacement Medicare cards using this website. The Medicare experts outside of your healthcare facilitators would be Social Security Administration or SSA. They're the experts on helping you enroll, being eligible, your premiums, and ID card replacements. CMS, or the Centers for Medicare and Medicaid Services, are the experts on service, claims, coverage, and how to understand your explanation of benefits. And then we have HICAP, who is the Health Insurance Counseling and Advocacy Program. And they're the experts in helping people understand Medicare and resolve your Medicare issues. And we'll provide their contact information in the resources tab. So what does UC require of you for Medicare? So enrollment in Medicare is mandatory. It is one of the UC sponsored plans, and enrolling in one of the UC sponsored plans subsidizes, often lowering medical plan premiums. Remember that no matter if you choose to enroll in a UC sponsored Medicare plan or an outside original Medicare plan, you will always have to choose a plan and pay a premium in addition to the Medicare premiums you pay directly to Social Security. UC requires that all retirees and their dependents over the age of 65 enroll in Medicare. If you're eligible for premium-free Part A, you must enroll in Part B. Enrolling in Medicare allows UC to offset the cost of insurance and pass those savings down to you. In order to enroll in the UC-sponsored Medicare plan, you must enroll in both Part A and Part B, and your Medicare card must reflect both. Failure to comply will result in penalties and permanent loss of UC medical coverage. Two exceptions to this rule are those who retired prior to July 1991, due to most of them not paying into Social Security, and those retirees who live outside of the United States where Medicare is not required. However, just remember that once you return to the United States, UC will require you to enroll in Medicare, so you may have a Medicare late enrollment penalty assessed by Social Security. Your employment status will determine when you or a family member will need to enroll in Medicare. If you become eligible for Medicare while you're still working and do not plan to retire, your Medicare enrollment is optional. Some employees do enroll in Part A because it's premium free and delay Part B because there will always be a premium. But again, this is optional if you're still working. The only exception is the health savings plan. You cannot have any parts of Medicare. You should delay enrollment in Part A and B if you are enrolled in this plan. If you do want to take some of Medicare for the health and you're enrolled in the health savings plan, you will need to enroll in another plan. Another exception is for Kaiser members. You can also delay your Medicare enrollment. However, if you're enrolled in Kaiser and you have numerous out-of-pocket expenses, enrolling in Part A and Part B may benefit you. If you're consistently spending more than what it would cost for you for Medicare Part B, so if you're spending more than $174 a month in co-payments, it may benefit you to enroll and pay for Medicare Part B. And if you do this, Kaiser is the only plan that will waive your co-payments while you're still an active employee and you're enrolled in Part A and Part B. Medicare also has different rules for domestic partners. So if you have a domestic partner, they will need to contact Social Security before they turn 65 to receive information on when and how to apply for Medicare. And again, if you're unsure, please contact those experts, Medicare experts, or Social Security directly. Now, if you're 65 or older and in the process of retiring or planning to retire, the Retirement Administration Service Center, or the RAF, will send you a Medicare packet given you've checked the Medicare eligible checkbox during your processing of your personal retirement profile, or your PRP. The Medicare packet will include instructions on how to enroll in Medicare. Next, you and any enrolled family members who are eligible for Medicare will need to complete the CMS L564 form and take it to Social Security to enroll in Medicare during your transition to retirement. The healthcare facilitator team can assist you with completing this form. This verifies that you were covered under the employer health coverage after the age of 65. Once you're enrolled in Medicare, you and any eligible family members will need to complete the appropriate UBIN form. to assign your UC plan to the Medicare Partner Plan and return that form to the RASC, include a copy of your Medicare ID card. If you plan to retire, for instance, the July 1st magical number, and you're eligible for Medicare, you should start applying for Medicare on or after May 1st, and then request for coverage to begin August 1st. Now, if you're already retired and turning 65, you'll also get a packet from the RASC, and it is called the Aging In Packet. They'll send that packet 90 days before your 65th birthday, and it'll include information on and instructions on how to apply for Medicare. Once you're enrolled in Medicare and have your ID card, you will complete the UBIN forms listed here to assign your prescription drug coverage to the UC-sponsored Medicare plan and submit the form plus the copy of the card to the RASC. You can submit this either by fax or uploaded to your UC Raise account. Now, here's an example of when to enroll in Medicare if you are already retired. For this example, the person is aging into Medicare in the month of April, and UC will send the information packet or the Aging In packet in January. You have 3 months, January, February, and March, to complete your paperwork and submit it to the RASC, and then your Medicare will begin April 1st of that year. If you fail to submit your paperwork by April, May, June, and July, you will be assessed a late enrollment penalty that will be deducted from your pension check. The amount and the penalty that they're assessing is $419.60. Again, if you're not eligible for Medicare, you still need to log into Social Security and apply. Request a denial letter if you're denied and notify the UC, and they will allow you to stay in your current non-Medicare plan. We want to remind you that enrolling in UC Medicare, a UC-sponsored Medicare plan, is not automatic. There is a two-step process that needs to be completed before you can enroll in a plan. Again, apply online, via phone, or in person. That's step 1. Apply, enroll in Medicare. Your second step is to submit your UC forms and submit your proof of Medicare enrollment to UC. So complete and submit the UBIN forms, or you can complete a life change event in UC Raise and upload the documents there. So to enroll via UC Raise, you must first log in and select retiree insurance. You can either select a life event changes or assign Medicare. Review the life event changes screen and initiate the life event. Select Medicare assignment. Enter all your Medicare information from your Medicare card, and then check the enrollee in Part A and Part B boxes. Review it and update it, and then that will bring up your UC contribution amount, so how much you will be paying out of your pension check. Then choose your that won't say the amount yet. Then choose your Medicare plan. Once you check the Medicare box and click calculate, that will show you your total costs and reimbursements if you qualify for a reimbursement. And then on the Medicare questionnaire page, you will fill out the application. Make sure you check the arbitration boxes, review any important notices, confirm, and then you will get a message, an email to sign. So there are various plan options through UC-sponsored Medicare. We have supplement plans, advantage plans, and then we have plans through VIA benefits. So we offer a variety, and you may receive offers to enroll in a non-UC Medicare plan, even from insurance carriers like Kaiser or United Healthcare that work with UC. These offers are for individual Medicare plans, which may not cover all the benefits offered by your UC group plan. So consider carefully before making any plan changes. You may only be enrolled in one Medicare plan at any one time. So you are able to have a Medicare plan with original Medicare, but if you do, you cannot be enrolled in one of UC's Medicare plans. So your options depend on where you live. For Medicare eligible retirees and their family members who reside in California or a California service area, the plan options are Kaiser Senior Advantage, UC Medicare Choice, UC Medicare Choice PPO, with or without prescription drugs. And although high option is not available at the time of retirement, as it does not have a non-Medicare partner plan, it is available during open enrollment. Split families or retirees who have some family members in Medicare and others who are not, who moved outside of California, but remain in the U.S., will be eligible for the split UC Care, UC Medicare PPO plan, or core UC Medicare PPO plan. Retirees who move outside of California but remain in the U.S. and all family members are eligible for Medicare, they will transition into the Medicare Coordinator Program administered by VIA Benefits. If you plan to move overseas and you are Medicare eligible, then UC Care and Core are your plan options as they offer international coverage. Since Medicare is a federally run program, Medicare plans are not available when residing overseas. When shopping for Medicare plans, you have two coverage options. Option number one are Medicare supplement plans or Medigap plans. These plans help pay some out-of-pocket costs not paid by original Medicare Part A and Part B. Medicare's primary and the supplement plan is secondary. And sometimes there is a separate Medicare Part D plan. For option one, we do have the Medicare PPO and the Medicare PPO without prescription drugs and high option supplement to Medicare plans. Then option two are your Medicare Advantage plans or Part C plans. That combines your A's, your B, and your D. It may include additional benefits included in the plan like glasses, gym memberships, and worldwide coverage. And the two options that we have for Advantage plans are UC Medicare Choice PPO and Kaiser Senior Advantage HMO plans. And we'll discuss those in more detail in a few slides. As stated in the previous slides, you may receive information and offers for an individual Medicare plan. While there are some similarities to UC's coverage offers, UC's coverage offers more than an individual plan would. This is because UC's Medicare plans are designed specifically for UC retirees. There are different enrollment periods. You can only change plans under an individual Medicare plan during the annual election enrollment period, and that occurs annually from October 15th through December 7th each year. Individual Medicare plans are generally available to anyone on Medicare with your plan within your plan area as determined by your zip code. You will handle your own enrollment and disenrollment. And enrollment in an individual Medicare plan may disenroll you from your UC Medicare plan. And then UC Medicare plans generally can be changed during open enrollment as well. Our plans are only available to UC employees and are those who are eligible for retiree health benefits. And the really big thing is there are no pre-existing condition exclusions for UC Medicare plans. So you can change plans every year. And again, you're only allowed to be enrolled in one Medicare plan at a time. And then we also have that Part B reimbursement that's offered to some UC plans and depends on what you qualify for. That's not offered under any individual plan. Retirees and some family members are eligible for Medicare while some are not. If you have this in your family, you would be considered a split or a mixed Medicare family. Those who are enrolled in Medicare will enroll in a Medicare plan that is the partner plan for the non-Medicare plans. And the non-Medicare members will stay or stay enrolled in the plans on the left. The Medicare plan members will enroll in the plans on the right. We want you to remember that the retirees plan is the one that drives the dependents plan. By saying this, an example would be if the retiree is non-Medicare and enrolled in UC Blue and Gold, their spouse that is Medicare eligible must enroll in UC Medicare Choice PPO. And then again, that the health savings plan does not have a non-Medicare, does not have a Medicare partner plan. So if you choose to enroll in a Medicare plan and your non-members are, you have members that are not eligible, you will have to choose from one of the other plans. So let's talk a little bit more about the supplement plans. So UC's PPO supplemental plan is UC Medicare PPO, and you can get that with or without prescription drugs. If you do get it without prescription drugs, you will have to enroll in the original Part D plan with Medicare. If you're currently enrolled in CORE or UC Care, your plan will be UC Medicare PPO. With the supplemental plans, Medicare is primary, and then Anthem Blue Cross is your secondary. Your supplement plan will pay 80% after Medicare for most services. You pay deductibles and co-insurance, so you would pay 20% of whatever Medicare does not pay. You must receive care from Medicare certified providers, and we want you to make sure that you ask your providers, your current or possible providers, if they're currently accepting new Medicare patients, because sometimes they are not accepting new patients, so you will have to pick an additional provider. High Option is another supplement plan that is available during open enrollment when everyone in your family is enrolled in Medicare. This is the UBIN form, the UBIN 123 for all of the supplemental plans. You would complete this for UC Medicare PPO, and the effective date is based on the date that it's received. You will complete this for UC Medicare PPO without prescription drug, but you should also complete the UBIN 100 in addition to this form. And you must provide proof of your prescription drug coverage. And you will, as we said, purchase a separate prescription drug coverage plan. For UC High Option, this is also the form to use. As we stated, only enrolling during open enrollment, and all members must be enrolled in Medicare. And most services are paid at 100% after that deductible is reached. The benefits of going into the supplement plan is you can go to any provider that accepts Medicare. No referrals are needed for specialist visits, and it offers global care for retirees traveling or living abroad for up to 6 months. Outside of that, you can access preventative care, emergency care, and prescription drug coverage globally. Advantage plans. Under a Medicare Advantage plan design, you assign your Medicare to a Medicare-approved insurance carrier that follows strict rules set forth by Medicare. Whenever you visit your provider will bill your insurance carrier directly. Under this plan design, you do not have a deductible, and you pay co-payments for services. UC currently offers 2 Medicare Advantage plans. We have Kaiser Senior Advantage, administered by Kaiser Permanente, and it is a Medicare Advantage HMO plan design. This means you must stay within the Kaiser network, and referrals are required to see a specialist. And then we have the UC Medicare Choice PPO plan that's administered by United Healthcare, and it is a Medicare Advantage PPO plan. This means you have the flexibility to see both United Healthcare and Medicare providers, and you do not need a referral to see a specialist. The provider must accept Medicare and the plan. For Kaiser, the UBIN 127 form is the form that needs to be completed. And then you would have Northern and Southern Kaiser Senior Advantage coverage, depending on your zip code. The effective date of the UBIN 127 is based on the date that it's received. And the benefits for going with Kaiser is you may qualify for a Part B reimbursement, depending on your UC contribution amount. It coordinates as an in-network model. There is an eyeglass benefit incorporated into the plan, and the premium is one of the lower premiums, and the out-of-pocket costs are lower as well. It does offer worldwide emergency coverage. United Healthcare is the second Advantage plan, and it is a PPO model. The form to use is the UBIN 121. The benefits is you may qualify for a Part B reimbursement depending on your UC contribution amount. They do have a special dedicated line for UC members. Out-of-network coverage is covered at the same cost of in-network providers. Lower premiums and out-of-pocket costs for this plan. And they are offering new offerings like hobby classes, among other things. And just to throw it out there, Scripps is still covered under the United Healthcare UC United Healthcare Advantage plan. So for the health savings plan, as we mentioned several times, once you become eligible for Medicare as a retiree, you must choose another plan. It is not compatible with any parts of Medicare. So if any of your family members or yourself become eligible for Medicare, you must contact UC and enroll in a different plan. You must stop contributing to the health savings plan the month Medicare begins, and the funds in your account may not be lost and you can continue to use them for eligible expenses. You may take a distribution at the age of 65, but it will be taxed as normal income. And unless you inform UC, we will not know that you're enrolled in Medicare. So it's your responsibility to ensure that you meet the health savings plan eligibility requirements when enrolling in Medicare. As stated in the previous slide, if you're enrolled in the health savings plan, when you retire, you must choose from one of the other health plans. And these are the UBIN forms when choosing another plan. The benefits for retirees living in a state outside of California. If you reside outside of the state of California and all family members are enrolled in Medicare, your benefits will be administered through Via Benefits. Via Benefits is UC's Medicare Coordinator Program, specifically for retirees living outside the state of California. To be eligible for this program, the retirees and all covered family members must be eligible for and enrolled in Medicare Part A and Part B and aged 65 plus. So just not be enrolled in Medicare due to disability or end-stage renal disease. So enrolled Part A and Part B and 65 or older. They must live in a U.S. state outside of California, be eligible for UC retiree health insurance, and submit the form UBIN 100. The UBIN 100 form will change your address to the state that you're in, and it'll inform Via Benefits that you are eligible. You can contact Via Benefits directly at the number listed here. And if you do contact them directly, please be sure to mention that you are part of the UC Retiree Health. If you have family living outside of California and everyone is not eligible for Medicare, you can enroll in the Anthem UC Care Core or the UC Medicare PPO. You must submit both the UBIN 100 and UBIN 123 forms for you to stay enrolled, for your non-Medicare members to stay enrolled in the non-Medicare plan and the Medicare member to go into the UC Medicare PPO plan. So retirees enrolled in a Medicare plan through VIA Benefits will have the choice to choose plans local to the city that they reside and a plan that meets their health and budgetary needs. Each family member can select their own plans and may receive personalized assistance from the customer service reps at VIA Benefits. So one person could be on Kaiser and the other one could be on United Healthcare. UC will provide an annual contribution for each family member under a health reimbursement account based on your graduated eligibility. So this amount can range from $1,500 to $3,000 depending on the retiree's graduated eligibility. You may use these funds to pay for your medical premiums, prescription drug premiums, or that Medicare premium that we spoke of, along with other eligible expenses. You will be contacted by VIA Benefits when you become eligible. And if you need any additional changes that you need to make to your dental, your vision, or your legal plan coverage, you should complete the UBIN 100 form if you're enrolled in VIA Benefit. Medicare plan premiums. So as an active employee, your premiums are based on your income or your pay band. But once you retire, your premiums are based on your service credit. Currently, UC shares the monthly cost of medical and dental coverage with eligible retirees up to a maximum UC contribution that varies each year depending on overall cost. Depending on the tier that you fall under, retirees may be eligible to receive anywhere from 5% to 100% of UC's maximum contribution to premiums. This is known as graduated eligibility. The amount UC will contribute depends on your retirement tier, your years of service credit, the coverage level that you choose, the plan that you choose, and whether or not you're Medicare eligible. When you're doing your UCRP service credit, remember that your years of service are based on whole years. So if you have 16.9 years of service credit, your premium will be based on 16 years of service. So here's an example of retiree covering a spouse or child. Everyone is enrolled in Medicare and enrolling in the UC Medicare PPO plan. Your premium, so we have in white is, or in black is what the current rates are. And I did include the 2025 rates so you can kind of see the difference as we prepare for open enrollment. So right now, the premium for everyone enrolled in Medicare, the highlighted section, is $180.42. Next year, that same plan with everyone enrolled in Medicare will be $184.20. So an increase, but not as significant as it was from 23 to 24. And this monthly premium is what's deducted from your pension check. And then as you can see right below that, there's zeros for your Part B reimbursement. So you can see that there's no Part B reimbursement, but you can see that Kaiser still has a reimbursement, but Choice no longer has a Part B reimbursement. So let's quickly discuss the Part B reimbursement. Medicare Part B reimbursement may apply if your premium cost is zero. So Part B reimbursements are based on the Medicare Part B premium of $174.70. And reimbursements vary and are added automatically to your monthly retirement payment. You pay the Medicare premiums we discussed to Social Security, and then UC reimburses you on your pension. And the premiums that you're seeing on your screen are based on 100% UC contribution. So if we want to go over this really quickly, Kaiser's reimbursement is going up. They still have a zero premium, and it looks like the entire $174.70 Since we don't have the 2025 Medicare premiums, it's going off the 2024 of 174.70. High option supplement premiums have gone down a little. Your Medicare choice is no longer a zero premium. It has gone up. Therefore, the Medicare Part B reimbursements are down to zero. And then your Medicare PPO without prescription drugs provides the 174.70 just as Kaiser does for your Part B reimbursement. So this is a breakdown of a retiree covering a spouse or child. Everyone is in Medicare, which is MM is Medicare, means Medicare eligible child and Medicare eligible retiree. If we break this down, the total monthly premium for this plan is $920.62. And then this person is receiving 100% UC contribution. So they're going to get the total $740.20 that the max that UC will pay, leaving the remainder of $180.42 that the retiree will be responsible to pay. If we add that to the 174.70, which is the Medicare payment per person, this person will be paying a total of $529.82 out of pocket. The 180.42 will be coming out of the retirement check or the pension check, and then each person will be paying the 174.70 directly to Medicare. Now, this is a side-by-side breakdown of the costs using the UC Davis Retiree Estimator tool that's available on UCNet. This tool can help you understand what your share of costs will be for retiree medical and dental. So this is someone that's paying the same plan for someone receiving 100% UC contribution compared to someone who's only receiving 50% of UC's contribution. So as you can see, the responsibility of the retiree will go from 180.42 up to 550.52. And again, this is the amount that will come out of the pension check. Even if this person is only getting 50% of the UC contribution, they will still be responsible for the total of the 174.70 paid directly to Social Security. Again, this is the Retiree Health Plan Premium Estimator provided by UC Davis. If you go onto this website, scroll down to retiree rates and open the UC Retiree Premium Estimator, you can input your information and see what you would be paying as a premium for each of the plans. You can toggle here in number 4 and pick different plans to see what your premium would be. There is going to be a new tool through Jellyvision that we discussed during the open enrollment presentation that's similar to this, but it's without you uploading an Excel spreadsheet. It is just the website. So we've said this several times, but you'd be surprised how many questions we get about premiums and why is Medicare charging me? So your Medicare premiums are assessed by Social Security and paid by you out of your Social Security income. UC does not pay any of your Medicare premiums. You pay those out of your Social Security income through Easy Pay, through Medicare Easy Pay, or they bill you by mail quarterly. Now, what UC does help pay are your UC premiums, those premiums that we discussed that are deducted from your pension plan or your pension payment. Or either we're deducting from your pension payment or we're providing a Medicare Part B reimbursement. That's a credit to your pension check. And again, it's only available to those in the least expensive plans. This year, it'll only be available through Kaiser. Now, things to consider when choosing a plan. First thing always say is to check your drug formularies on the plan's website to see if the prescriptions you're taking are there, or if you need any prior authorization or any documentation from your provider. Match your priorities with the plan that is with what is match your priorities with what the plan is offering. If you need a specialist that's not in a provider network, are they available on another plan? Do a cost analysis on what your out-of-pocket expenses may be if you enroll in that plan. And as always, review the evidence of coverage booklets that can be found on UCNet. Also visit the Healthcare Facilitator Blink page where you can read the fine print on the plans. You can also find recorded presentations and printed materials to assist you in the decision-making process. Some best practices for Medicare enrollment is make sure you're using the current and most correct and current forms. Complete them fully. Sign your name. You have to have a wet signature. Date it and make sure the arbitration boxes are checked on the UBIN forms. Include a copy of your Medicare ID card and provide with both Part A and Part B on it. Or if you don't have the card in your hand, the letter from Social Security that highlights Medicare benefits with Part A and Part B. Not the proof that you enrolled, but we need the one that says your Medicare benefits will start blah, blah, blah. Make sure all your Medicare premiums are paid. Keep your address up to date. You cannot use a P.O. box when enrolling in Medicare. They require a physical address. Forms cannot be submitted 90 days prior to the start date, and they expire 90 days after. The best way to track your form is to check your UC Raise account to see that it's been updated. And then any changes to your name and date of birth must go through Social Security if it's incorrect. Remember, retiring is not a qualifying event to change plans. A qualifying event could be moving out of the plan service area, having a newly eligible dependent, a new marriage or domestic partnership, involuntary loss of group coverage from another provider, or enrolling in UC's health savings plan and you're eligible for Medicare. Open enrollment is when you should change your plans, and this year's open enrollment is October 31st at 8 a.m. through November 22nd at 5 p.m. The web page, the open enrollment web page will go live on October 22nd. If you choose not to enroll in one of UC sponsored plans, if you decide to enroll in a commercial Medicare plan, which you're more than welcome to do, you should complete a UBIN 100 form and suspend your UC medical coverage, and so you don't have any penalties for not enrolling. You can always come back if you don't like the plan that you selected outside of UC. Once you're ready to return to UC, during open enrollment, you should complete the UBIN 100 form and any subsequent UBIN form for the plan that you would like to enroll in. To be in compliance, you must either enroll in Medicare or suspend your coverage, so you won't be assessed that Medicare premium offset of $419.60. And again, it's charged for 3 months per member. So it could be 3 months for yourself as well as 3 months for dependents that weren't enrolled. And on the 4th month, they will terminate your coverage. So as it states here, compliance is a priority because it reduces the cost of retiree health, and we provide resources to help people stay in compliance. So always reach out to the healthcare facilitator team or RASC if you feel like you're out of compliance or you want to make sure you're in compliance. Really quick question or test your knowledge. Barbara is celebrating her 65th birthday and plans to continue working another 3 years. She was told by a coworker she needs to enroll in Medicare to avoid being penalized. What should Barbara do about Medicare? Should she contact Social Security and enroll if she's still working, or delay enrollment in Medicare because she's enrolled under a UC-sponsored medical plan? If you said number 2, ding, 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 you are correct. She will have a special enrollment period when she retires. So if Barbara is covering a spouse, her spouse will also have that special enrollment period. The healthcare facilitators will complete the CMS form for both the spouse and Barbara, and they can enroll during the special enrollment period without penalty. Then we have Anna. She's 66 and ready to retire. She's worked for UC and never paid into Social Security, does not have the 40 credits to qualify. Her husband's 60, but he has earned his 40 credits. So the first question is, what will happen to Anna when Anna applies for Medicare? If you said that they will tell her she does not qualify, you are correct. She will get that letter from Social Security stating that she does not qualify. She would submit that to the UC, and she'll stay on her non-Medicare plan. However, when should she reapply? Remember, we stated you can apply under a spouse, a current spouse, former spouse, or a deceased spouse's record when they turn 62. So once Anna's husband turns 62, she will not get any notification that she needs to reapply when her spouse turns 62. She should make note in her calendar to know when to reapply. See, if she doesn't enroll when he turns 62 and waits till he turns 63, she may be assessed a penalty. And her premium may go up by 10%. That late enrollment penalty for each 12-month period, she could have qualified for Part B but didn't sign up. So it's very important if you're going to do it under a spouse to remember that 62, the magic number 62. Some tools and resources for Medicare planning. You have us, the healthcare facilitators. We have a presentation, health insurance after you retire, every third Wednesday. Right now, they're suspended until after open enrollment, but we do have open enrollment presentations during this time. We also have the help desks every third or second and fourth Thursday of the month, and those are also being open enrollment only help desks, and we'll discuss that in the next couple slides. We also have the Healthcare Facilitator Medicare presentation. We have completed the last one last month, and the next offerings will be in 2025, but recordings will be available. There's also the Understanding Medicare on the UCNet page, and then you can do the Medicare plan comparison on the UCNet page as well. The RASC is another great resource. We have the member services line here for you. The UC Raise, you can submit forms, contact info updates. You can change your beneficiaries. You can change your, do a life event changes. You can also change your banking information via UC Raise and send secured messages to the RASC. Also, UCNet, we provided a couple of resources via UCNet throughout the presentation, but it is where you will get all of your open enrollment information, updates, guides, forms, booklets are all on UCNet. And then the RASC portal is where you can schedule retirement counseling, get retiree resources and newsletters. They also have a monthly webinar for Medicare, and they also are doing a weekly Q&A session for Medicare. During open enrollment, the RASC is offering office hours on the dates listed here, and there is a link for access to the virtual access to the Zoom. and it's I think it's Thursdays, every Thursday from 12 to 1 throughout open enrollment. And then the healthcare facilitators are also offering office hours on the dates listed here via the Zoom links listed here. This information is also on the healthcare facilitator link page. OE activities are located on the healthcare facilitator link page. We are having presentations throughout open enrollment, as I mentioned, help desk throughout open enrollment. And then on November the 15th, there will be a virtual open enrollment fair where you can log on during certain times that the vendors will be available they'll do an open enrollment presentation and offer question and answer sessions at the end. That can all be found either via the open enrollment link page. You can scan the QR code here, or through the healthcare facilitator page. You can click the link here. And last but not least, other tools and resources are the UCNet page, medical plan cost and plan comparison page, the Medicare and medical plan comparisons, fact sheets, CMS contact, Social Security contact, HICAP contact, via benefits contact, the Retirement Association's contact and membership information, the Health Sides Benefits Office and portal, the Campus Benefits Office and link page, as well as the healthcare facilitators email and the Blink page. Myself and Lilia's information, Lilia services employees and retirees, letters, last name A through M, and I service employees, last names N through Z. However, we both will help anyone. I know there's been a lot of information, so we're going to open up the floor for question and answers. And thank you so much for listening to me ramble for the last hour. Hopefully you got your questions answered. If not, I am here to answer them. Lilia, are there any questions in the chat?
Yes, we do have one. If we're going to have this presentation posted on the website, we normally don't, but I wanted to just check in with you. Maybe we have it, maybe Vanya has it on the.
Yeah, I believe
retiree?
Vanya has it
Okay.
on the retiree YouTube page. She just posted it it's on the Retiree and Emeriti YouTube channel.
That was the only question that was unanswered.
Yes, and if you'd like a copy of the slides, do you want to take emails down, Lily, or how do you want to handle the copies of the slides? Should we just post the copy of the slides on the healthcare facilitator page?
Oh, I was going to see if Vanya has a list of all the participants. Maybe she could just send that over to all of the participants.
That works as well.
I can do that, and I can copy you both on there or BCC just so you know it as well.
Perfect. Yes. I'll send it over as soon as we're done with the presentations. Any more questions?
Can I ask a verbal question, not in the chat?
Absolutely. Absolutely.
Great. So I am the UC retiree and I covered my husband. He turned 65. We both turned 65 next year, but he turned 65 before I do.
Okay.
So does he enroll in Medicare and change plans before I change plans?
Yes.
Okay.
He will change plans according to his birthday. So say for instance, he turns in February, you don't turn until October. He will get his packet 3 months before his birthday. And he will need to enroll in Medicare and do go through the whole process of enrolling in Medicare and the UC sponsored plan. And then 3 months before you in October turn 65, you'll do the same process. So you guys will be considered a split family until both of you guys are enrolled in Medicare.
Great. Thank you so much.
You're very welcome. And I keep wanting to reiterate that UC does not pay your Medicare premiums directly to Medicare. You pay those your own. I've gotten several calls in the last few months saying, why am I getting billed by Medicare? I thought UC was paying. We do not pay your Medicare directly. That is paid by you. And if you're enrolled in one of the Medicare plans that offers a Part B reimbursement, you'll get a reimbursement. Otherwise, it's on you. Yes, Marlene.
Just to be clear, because I think some of the confusion comes from the following. When I retired or when we were working and everyone said, UC covers 100% of your cost when you
Yes.
have 20 years of service. And so you thought that, and
Right.
no one really explained about the Medicare cost.
Right, right.
And to be clear from what you described, the UC will not reimburse you for the $174 a month unless you are Kaiser. Did I understand
For
that?
2025, yes.
Okay.
Previously, for UC Medicare Choice, it didn't have a premium either, but because everything increased this year, now it doesn't. You don't qualify for it anymore. So yes, if you're enrolled in Kaiser, that's the only way you'll get that Part B reimbursement. Kaiser or the UC PPO without prescription drugs.
Okay. So if you were on Blue and Gold and you switched to the UC United Health
Choice.
PPO,
Right.
no reimbursement.
Not anymore. Not for 25. No.
So you should see it for 2024 though?
You should see it for the remainder of 24 if everybody in your plan is on Medicare.
Yes. Okay. Got it. Or if you're just yourself.
Well, you won't see it if it's just yourself. Technically, yes, but you won't see it because you're paying for that non-Medicare plan. So you're still going to have something coming out of your check
Check.
for a premium because you're still paying that non-Medicare plan. So
Okay. Okay. Thank you.
had you both been on Medicare, then yeah, you would see the reimbursement on your
Well,
check. But since
My
it's
husband and I are both UC retirees, so we each have our own
gotcha.
stuff.
Gotcha. Okay.
Right?
Yeah. But are
Okay.
you both on the same, is one
Yes,
person
we were
covered?
both Blue and Gold. He just qualified for Medicare in October and I qualify in November.
But you both have separate plans. So you're only
Both
covering
the same-
yourself.
Yeah, we each were covering ourselves. Yes.
Okay, so he should receive it for 2 months. You'll receive it for 1 month.
Got it. Okay.
But
Woohoo.
then you'll have a
Nothing.
premium in the following.
All right.
Yeah.
Thank you.
But if you're at 100% UC contribution, which I
We
believe
were.
you are.
Yes.
So yeah.
Yeah.
So yeah.
Yeah.
You'll both see it. I saw some
Yes.
questions
Thank
coming
you.
in. You're very welcome. The last slide. Oh, okay. Medicare package is sent automatically 3 months prior to my birthday. I'm gonna say yes, it's supposed to be, but the RAS, sometimes they lag behind. So if you don't receive that packet 3 months before, if you're feeling a little antsy, contact the healthcare facilitators. We'll tell you exactly what you need to do to start the ball rolling. So even if you get the packet after your 60 days before, you'll already know what you need to do and you can already have the process started. You're welcome. Any other questions? I'm here.
I have a verbal question, please.
Absolutely.
Hi, thank you. Yes, just first I want to say that the HCF staff at UCSD was very important in navigating me through the July 1st retirement from UC.
Awesome. Glad we were able to help.
Thank you both very, very much.
You're welcome.
So I just have just two questions here about some things I see on my UC pension statement.
Yes.
Yeah. So one thing I see is an income. It says Part B reimbursement of about $21.
Uh-huh.
Is that typical, I guess?
So you're either in Kaiser plan or you're either in United Healthcare.
I'm in United Healthcare. Yeah.
So yeah, that's that Medicare Part B reimbursement that we've been talking about.
Okay.
That's what that is. So that's an addition, not a subtraction.
Yeah. Income always good. Okay.
Right.
Thank you. And the other one is the deduction. It says it says Med ER premium of about $350 a month.
So
Is that
anything
right?
that says ER is employer responsibility.
Okay.
So if you see ER in front of it, that means UC is paying it. If you see M as in Mary, B as in boy, R, that's member. That means you're paying it.
Yeah, so it technically reads med space ER space premium of $350.
Right.
So that's
Right.
that's like I pay it, right?
No, if it's ER, that's employer, so that's UC. Employer, not employee, employer.
Oh, okay. I haven't run the calculation there. Okay.
Yeah. So
Okay.
like I said, if you see, so you should see med, M as in Mary, B as in boy, R as in Robert, premium. That's what you would pay. If you don't see that, you don't see that because you're getting a reimbursement.
Okay.
But you
Okay.
should see DEN, DEN member premium, right?
I
Oh.
do see Den ER premium of $45 roughly.
That's what
That's my
UC is
dental.
paying. That's for your dental plan.
So they're paying that?
Yes.
Oh,
So you
okay.
must have more than 20 years, 30 years. So
I have
they're
thir- I have
paying your
like-
full
I have like-
dental.
I have 36 plus.
Yeah.
Yeah.
So they're paying your full dental, they're paying your full medical, and you're getting a
Oh, okay.
reimbursement. But if you, so next year, because you're on the PPO, the choice plan, and you're no longer going to be getting that Part B reimbursement, then you'll start seeing med member premium, and that's what you're paying out of pocket.
Okay. Thank you very much. I forgot, I misread the header where it says deductions / contributions. So what
Right.
those were actual contributions, not
Yes.
deductions. Got
Yes.
it. Thank you very much
You're
again.
very welcome. No problem. I saw something come in the chat. Was that a question? Are there any HMO options besides Kaiser? Not at this time. No. And I mean the non-Medicare, yes. You have the UC Blue and Gold, which is an HMO option. For Medicare, no. Kaiser's the only HMO option. You're very welcome. Well, that's it for me. Thank you guys so much. If you don't have any more questions, you're free to enjoy the rest of your afternoon and not hear me ramble anymore.
That was wonderful. Thank you so
Yeah,
much, Ronisha
yeah.
and Malia. Thank you.
Thank you. It was great.
Very welcome. You're very welcome. If you have any questions, don't forget you can always email that HCFhelp@ucsd.edu. It's in the chat.
Thank you.
You're welcome.